Okay, so thank you for joining us for this first Frontier Carer webinar. I hope that we'll do these more frequently on different topics. And this evening we're starting with a really, I think, key and important one. And we're joined by Jude Schulder from the Benevolent Society. She works in the aged care service team or the Care Finder team. And she's going to share some of her expertise on navigating the aged care system with us. So
Thank you.
over to Jude.
Thanks, Penny. Thank you, everybody. I actually can't see you. I can see Penny and I can see a black screen and I can't see how many other people there are. So thank you so much for joining the webinar. And I'd just like to pay my respects to the traditional owners of land and country and water and air in Australia, and pay my respects to any First Nations people who are attending the webinar. So I've been told if I share my screen and start my slideshow, you're going to be able to see some slides, and I'm going to do my absolute best not to make it death by PowerPoint. So we can start the slideshow. So navigating my aged care. Before I do a little bit of talk about my aged care, I'll just tell you I've been working in aged care for about 15 years. I've worked for not-for-profit organisations, and I have mostly been in the home care package space. More recently, I've been with Benevolen in a new program called Care Finder. But I spent a lot of years with managing home care packages and a few years at the start as a support worker. So I'm going to try and talk to you a little bit about my aged care and the assessment process, and that's the funded aged care services in Australia. We'll talk a little bit about Commonwealth Home Support Program. I'll talk about home care packages. There are some other things you can think about, other supports. We'll talk about your rights as a person accessing aged care services, and there'll certainly be time for questions at the end. And I'll do my best to not go too fast. If you think I'm going too fast, somebody needs to tell me somehow that I'm going too fast and I need to slow down. In Australia, most aged care services are funded through the federal government, the Australian government. State governments have their own services, and even local government has their own services. So you can have services from all of those people. Having one doesn't necessarily stop you from having the other. For aged care services, if you are fortunate enough to already be an NDIS participant, you can't also have my aged care services or aged care services. You can only have one or the other. So I don't know how many of you are in that circumstance, but you can't do both. So the place that you start is my aged care. So the federal government's way of, like, it's your doorway. You can call them up, or you can go online to register for my aged care. You need to be aged 65 or over, and you need a Medicare card, and that's about all you need. You don't need to have your birth certificate or your passport number or any of those things. I guess the assumption is if you've got a Medicare card, you've already proven to Medicare who you are, so we don't worry too much about that. My aged care support centre goes from about 8 a.m. to 8 p.m, Monday to Friday. On Saturday, they're open about 8 to 2, I think. They have a day off on Sunday. This is if you're looking for care at home or for residential aged care services. So my aged care is the place to start. And somewhere in this set of slides, we've got their phone number. Oh, there we go. So I'll just move myself out of the way. So you can call them up, 1800 200 422. Your GP could make a direct referral. A geriatrician or a healthcare professional can make a direct referral, or you can refer yourself online. If you think you are going to need some help to work your way through your services, it's great to have a representative in my aged care, someone that you trust, someone who you feel has your best interests at heart and who can help you to understand what's going on. You don't have to have a formal guardianship or a formal power of attorney or any of those things to have somebody be your representative in my aged care. The person who is your representative can't make decisions on your behalf. Their role is to help you out, help you to understand things, help you decide what to do next. So you register, which actually takes a little bit of time. So always be sitting comfortably and have a cup of tea. If you're going to call my aged care, it's never a quick process. So during the registration and screening process, you'll be asked a few questions. If you have fairly simple needs, you'll be pushed into a stream for entry-level support. If you have complex or multiple care needs, you go to a different stream. Until quite recently, there were actually two different assessment tools, but since the 1st of July 2024, there's now only one assessment tool. So everybody starts with the same tool and the same series of onboarding questions. Then you kind of get moved to one stream or the other. We were very hopeful when there was the talk of an integrated assessment tool that there would then be only one assessment. But unfortunately, it's still possible that you might end up having two different assessments in your journey through my aged care. So the regional assessment service, it's pretty quick to get an assessment, probably 2 to 6 weeks. The aged care assessment team, if you have more complex needs, you can end up with a big wait for an aged care assessment. So most people go through the regional assessment service and then end up going on to the aged care assessment team if they have some higher needs. There's things that the regional assessment service can't approve. So they're not going to be able to approve you for an out-of-hospital care or a transitional care. They can give an approval code for residential aged care, but they can't approve a home care package. Mainly what they do is give you a whole lot of referral codes for the Commonwealth Home Support Program, which is, the acronym for that is CHSP. Some people call it CHSP, RISPs. But CHSP will call that service. So it's a bit of a fee-for-service, discrete services. You might have multiple CHSP services, but there's no kind of overall coordination of your services. If you go down, if you're pushed in, go into the path of a home care package, the aged care assessment team will ask you a whole lot more questions. And if you're approved for a home care package, you will then be put on the national waiting list. And when a home care package is available, you will be assigned a home care package. There's different levels of home care packages. So we'll go on to the next one. The Commonwealth Home Support Program. This is where most people start. So it's entry-level support services to live independently and safely at home for people who need help with everyday tasks and just feel like a little bit of help could improve your health and your well-being. 65 years of age or older, 50 years of age or older for a First Nations person. If you're homeless or at risk of homelessness, you can get special assistance through the CHSP for those homeless services. There is a fee for service for a CHSP service or a client contribution, and it depends on the provider what that fee might be. There's no formal means testing for CHSP fees, but a provider, if you are unable to afford the fees, a provider can give you the opportunity to apply for a financial hardship so that the fees are reduced, or in some circumstances, the fees are waived. The client contribution is usually something like $15 an hour. It might be cheaper in some places, might be more expensive. But it is a fee for a service, and there are kind of distinct rules about how many hours of service you can have under CHSP. Because it's entry level, people are not expected to need multiple CHSP services. If that's your circumstance, it's expected that you would end up in a home care package situation. So, for example, if it's a personal care assistance, it's unlikely you'll get personal care every day. It's more likely you'd get it 3 days a week. If it's cleaning, it'd be cleaning once a fortnight. It won't be cleaning once a week. They're quite low level for people who are mostly independent but just need a little bit of help. And what kinds of services can you get under CHSP? Domestic assistance, having a bit of cleaning at home is the one that most people start off with. Sometimes also transport if you're no longer able to manage your transport. Lawn care, gardening, that's something that can be difficult for older people to manage. Nursing services, if you need wound care, you might end up with nursing services. Social support, if you're a little isolated, becoming isolated because you can't get out as much as you did before. Social support is a common service, and assistance with shopping is also pretty common. And there's a beautiful picture there of somebody having respite. There is a service, a great service called Flexi Respite. If you're approved for Flexi Respite, that means you've got a carer who needs a bit of a break. And if you're approved for Flexi Respite, lots of things can be done during a Flexi Respite service. But the trick is, once you've had your assessment and got all of your referral codes, you have to find a provider. And that can be pretty hard at some times of the year and in some parts of our beautiful country. One way to start off is to look on the My Aged Care website. They have a tab called Find a Provider, and you can say that you've got approval for a particular service. You can say your postcode where you live, and they will give you a list of providers who you can contact to see if they have the capacity to take on your service. CHSP is funded for outputs. So at the start of each financial year, the providers are funded for a certain number of outputs, 10,000 hours or 20,000 hours or whatever it might be for their service. If they use all of that funding in the first 3 months, then they won't have any more outputs for the rest of the financial year. So they try and manage so that they can provide services over the entire year. Sometimes if they think they have taken on too many clients, they might close their portal and not take on any new clients. Sometimes you get to about March or April in the calendar year and the CHSP providers take a look at what they've used and decide, oh, we need more clients because we haven't used all our outputs. So they might open their portals up again and take on new clients. So usually around March or April is a good time to look for a provider. And sometimes July, August is a good time because they've opened up the new financial year, they've taken a look, they've decided they can afford to put on a few new clients. But it can be quite tricky. It can be a lot of resilience and making a lot of phone calls to a lot of providers before you can find the people who are going to be able to help you out. Home care packages are a little different. So if you are assessed and someone from the aged care assessment team approves you for a home care package, you are put on the National Priority System queue to await assignment of a package. Sometimes you can get a package pretty quickly, depends on the level of the package. Sometimes it takes a lot longer. It's actually quite common, unfortunately, for people to wait 6, 9, 12 months or even more for a home care package. And a lot of things can happen in that time. It can be quite difficult for people to have to wait. During the time that you're waiting, you would get letters, lots of letters telling you 6 to 9 months, 3 to 6 months, 1 to 3 months, and giving you a bit of warning that you've progressed in the queue. If you are assigned a home care package, or when you are assigned a home care package, you'll have 57 days to make an agreement with a home care package provider. There are a few different fees for home care packages. There's a thing called the basic daily fee, which is about $10 a day. Not many providers charge the basic daily fee. If your provider does charge that, they add it in and wrap it up in the budget, and they use that money for services for you. But it's pretty easy to find a provider that doesn't charge that fee. There is a thing called an income-tested care fee, and providers will charge you that fee. They won't have any control over what that fee is, because that decision is made, that determination is made by Services Australia. If you are on the age pension and you are receiving the full rate of the age pension, your income-tested care fee is most likely to be $0. If you're a part pensioner or a self-funded retiree, it can be much more than that, up to $30 a day. For a home care package, the money comes in daily, so the fees are charged daily. So if you are, even if you're only receiving one service a week, your money is coming in daily, so your fees are charged daily. It's quite difficult for people to understand how that works. It's just the way the system has been designed. So if you have a small income tested care fee, happy days, you might get your home care package and only pay $7 if your income tested care fee is $1 a day. But if your income tested care fee is $20 a day for the week, you would be paying $140 for your home care package. Sometimes people just genuinely can't afford that and they prefer to stay on the Commonwealth Home Support Program. But providers don't have any choice but to charge the income tested care fee. It can be quite a difficult decision for people to make. So these are the package rates, the amount of money that comes to your provider to provide the services to you. So there's 4 different levels of a home care package. There's level 1, 2, 3, and 4. You can see that the money that's coming in increases dramatically once you get to level 3 and to level 4. As well as charging you for the income tested care fee, that is expecting you to pay it out of your pocket, your home care package provider will charge fees against the money that they're receiving. So they'll have a fee for package management and they'll have a fee for care management. And there are limits to the top amounts that they can charge, but they will charge something for each of those things. And every home care package provider will be willing to talk to you about what their fees are, because it's very competitive in the home care package space. There's a lot of providers and a lot of people wanting your home care package because they can charge you for package management and care management. The other things that they'll charge you for out of your home care package funding, they'll charge for the hours that they send somebody to your home. Or if you're using your funding for equipment, they'll charge you for the hire of the equipment or the purchase of the equipment. Every month, your home care package provider will send you a statement showing how they've used the money. So every month, usually in the following month, you'll receive a statement telling you in the month of July 2024, we used your money on, we charged you package management, we charged you care management, we charged you $75 an hour for the care workers, and we charged you $500 to rent the hospital bed or whatever it is. And you can get those, you can have your case manager who will be assigned to you to manage your home care package. You can ask them to explain all of that to you. That's part of their role as the care manager and the case manager. In the olden days, a home care package belonged to the provider. So you had to find a provider that had a package available. And it was very hard to leave a provider if you weren't very satisfied with them. About 10 years ago now, the packages started to belong to the individual. So it was much easier for people to move between home care package providers. And that's a good thing for the home care package providers to have to provide a good service. If they don't provide a good service, everybody will move to another provider. It's not a difficult thing to do. It can be, some awkward conversations, but it's absolutely fine if you're unhappy with your home care package provider to move to another provider that you think will do a better job helping you out. And home care packages providers are very used to talking to people about their fees and charges and their services and the quality of their service. And if you go onto the My Aged Care website and ask for a list of home care package providers, almost anywhere you'll have, 120 phone numbers that you can call, or 120 websites that you can check out. It's a very competitive space, the home care package space. Sorry, what I should have said, I've just gone off the home care package thing, but there's lots of things you can use your home care package funding for. Direct services in your home, transport, social groups, continence aids, equipment. You can hire equipment, or you can have purchased equipment purchased for you. Home modifications. If you need modifications to make your home safer for you and to increase your independence, you can use your home care package funding for that. There's a very small list of things you can't use it for. You can't use it for food. You have to be able to pay for your own food. You can use it for the preparation of meals, though, and meal providers, places like Light and Easy or Tender Loving Cuisine, or some of the big meal providers, will allow home care package clients, if the money is available, to place an order, and it's billed some to the person and some to the home care package provider. So the person, the individual, is paying for the ingredients. The home care package provider is paying for the meal preparation and delivery. So you'll often see ads for Light and Easy, and they'll talk about on the TV ads or radio ads, they'll talk about using your home care package funding for your meals. The things that you can't use it for are things like a holiday. You can't use it to pay for your family to care for you. You can't use it to buy a car. You can't use it for just general home maintenance. If you're living in your home, you're expected to maintain your home. So you can't use it for, painting your house or replacing the windows and the doors or whatever else. So just general home maintenance, that's your responsibility. But you can use it for specialised cleaning if that's needed for you to maintain your health and hygiene in your home. So other supports, there's a very happy gentleman out in his garden. The Taxi Transport Subsidy Scheme is a New South Wales government scheme for people who are no longer able to independently take public transport. The New South Wales government will fund 50 transport up to a maximum of $30 a trip. So that can be really handy if you can't manage to get on and off public transport anymore. Continence aids payment scheme, if you have an ongoing medical issue that means you need to wear continence aids, you can get subsidised help for the continence aids payment scheme. If you are at home and have lost some of your mobility, there's a wonderful scheme called the Short-Term Restorative Care, a wonderful program. It's an 8-week program, and you'd get intensive help with physiotherapy or occupational therapy. Residential aged care, I'm happy if there are questions about residential aged care. Most of you may not be at the stage of your life where you're looking for residential aged care, but if you are, that's a whole other conversation to have about how you make that decision and what the fees are. But I can answer some questions if they're simple questions. If you are unfortunately hospitalised and have had a change in your functioning, that might be able to be managed with a short-term program. There's a program called Compacts for out-of-hospital care. It's about 6 weeks, or it can be extended to 12 weeks, and you get short-term intensive services in that time. Carer Gateway, you may already be aware of the Carer Gateway. If not, Carer Gateway is a wonderful program if you have or are a carer and you need a bit of extra help at home. Carer Gateway is the government's way of saying, we know it can be hard for carers and we want to support them and give them a bit of help. So sometimes it's services in the home, it can be counselling, it can be support groups. There's a lot of fantastic help available through Carer Gateway. If you're on a very low income and you need to borrow money and you just can't pay for interest through regular means, there's a thing called the no interest loan scheme. There are EPA vouchers. EPA is for people who can't afford to pay for electricity or gas. And if you are interested in the no interest loan scheme or the EPA vouchers, let me know and I'm happy to send more information to you. You have to find an organisation that manages those things. It's often people like the Salvation Army or the St Vincent de Paul. Sometimes it's community groups who have access to the EPA vouchers and the no interest loan scheme. And Waterfix, we all love to give a shout out to the beautiful Sydney water people. If you've got leaking taps in your house, Waterfix will send plumbers out to help you out, and they charge a very small amount to do that. And they're great. I've used Waterfix myself a couple of times because we had leaking taps, leaking shower heads, and it was fantastic and it was very quick and very easy. Alrighty. I hope I'm not boring you all to tears. I hope you're all awake. Your rights in aged care. So one of the things that you will see and will be presented to you often in your journey with My Aged Care is the Charter of Aged Care Rights. And you have rights. So you have a right to safe and high quality care and services, to be treated with dignity and respect, to have your identity, culture and diversity valued and supported, to be informed in a way you understand, to access information about yourself, to have control over and make choices about your life, to have decisions about personal aspects of your daily life, to be listened to have a person of your choice support you and speak on your behalf, to make a complaint free from reprisal, to have your personal privacy protected, and to exercise your rights without adversely affecting the way you're treated. There's a lovely organisation called OPAN, and in New South Wales, the representative for OPAN is the Seniors Rights Service. If you are having a service and you are experiencing issues and you feel that your rights are not being protected, your service provider is not treating you in the right way, Seniors Rights can help to advocate with your service provider to get a better experience for you. You can always change a home care package provider. Unfortunately, changing a CHSP provider is actually more difficult because it's so hard to find them in the first place. If I were to say to you, you'll have 5 people to choose from for your shopping service or your domestic assistance or your personal care, that would be an exaggeration. It's not easy to find a CHSP provider. Ironic, because that's the place where most people start. So here's some phone numbers. My aged care number, this is there again, the Carer Gateway. Carer Gateway is open, I think, only Monday to Friday from about 8 a.m. to maybe about 5. But they're really great people to speak to. You may already know about the Dementia Helpline. Dementia Australia have got amazing resources, really wonderful people to deal with. And then OPAN, the Older Persons Advocacy Network. I should have put the seniors' rights phone number on there. I do apologise, but they're also fantastic people. And that's it for the things that I was planning to say, which has taken me half the allotted time. So I'm going to stop sharing my screen. And if you have questions in the chat, I can see something there. So I'll see what I can see in the chat. So no, My Aged Care is a national thing. My Aged Care is the federal government's way of anyone anywhere in Australia accessing information about aged care, linking into services, and being able to have the help and support they need. And if you are a person who is supporting a family member who's living in another state, My Aged Care is still a good place to look for resources and look for tips and tricks and start the journey. But Carer Gateway can be different in different states. But if you look if you do the Google that number, if you get through to the New South Wales provider for Carer Gateway, they will transfer you to the Queensland Carer Gateway if that's where your loved ones are residing, or anywhere else. Which I had to do last year when my dear old dad took a tumble at home and broke his arm, and he was the carer for my mum. And yeah, we had to spring into action and do our best to get some supports for them. They live in country Queensland. That was quite an education, and took people who really should know an awful lot about this a whole lot of time to get the help that they needed and find them a bit of respite. But there we go. He survived the experience, and so did we. Here we go. I'll say this question and then I'll give you my my advice. It says, my husband is 63. Would I be better off applying for NDIS or waiting for aged care? Which is better? And it will really absolutely depend on the medical information you have to support your NDIS application, whether you will be successful with an NDIS application. And I'm not an NDIS expert, but there are lovely people available. If you look in the disability, there's a place called the Disability Gateway. And if you call the Disability Gateway, they will be able to help you, to link you to a local area coordinator for the NDIS. And they will answer your questions about the level of evidence you would need for being successful in an NDIS application. But there is a lot of flexibility in the NDIS. A lot more flexibility, I believe, than in My Aged Care and aged care services. So a level 4 home care package at the moment is about the most that you're going to get in an aged care setting, and that's maybe, I think it might be somewhere between $50,000 and $60,000 of funding a year. But the NDIS can be a whole lot more generous than that, depending on the amount of care you need and what is approved in your support plan.
Yeah.
However, NDIS plans are reviewed annually. So every year you will have to put together your activities, your plan for your activities for how you want to use your funding for the following year. Once you're approved a CHSP service or a home care package service, you don't have to go through that approval process again. You don't have to prove that you still need the support, and you don't have to prove that you still have those same level of care needs. So if you put on a home care package, if you're given a home care package, that home care package stays with you until one of two things, or three things, I guess. You decide you don't want it anymore. You can say, look, it's not working for me. I don't want this home care package. Thanks so much. Really appreciate it, but it's not working for me. And off you go, and you're no longer on the home care package. If you move into residential aged care, your home care package will go. You can't have both. If you're a permanent resident in residential aged care, your home care package is stopped. And the other one, of course, is if you go to God, your home care package will stop. Unfortunately, you can't do both of those things. If that helps. NDIS, I've never worked in that space. I have helped people try to apply for NDIS packages. It's not an easy thing, and it really depends on the evidence that you have to help support that you need extra help in these domains.
Yeah.
In these areas of your life. When you are being assessed, please, please, please don't think about how you are feeling on your best day. Think about how you're feeling when you need the most help. If you say, I can do all these things, yeah, I can do this, I can do that, that's okay, I don't need that help, you won't get given very many approvals because you've just told the assessor that you can do all these things. So think about how it feels on the very worst day when you're feeling your worst. Yeah, always, if you say you can do things, you're not going to get any help. There you go.
I think that's the best advice for any application for support, be it NDIS or aged care. And I think, Kate, I can add on to the NDIS question. Jude's absolutely right. It depends on if your husband has a confirmed diagnosis. That's really one of the important things. And it's, if you want to drop me an email, I'm more than happy to see if there's anything I can do to help you with applying. Jude's also right that the scope of services available in NDIS are bigger. So there's a lot more opportunity for rehabilitation supports, allied health supports, community access supports. So we do encourage people to apply for NDIS if they can, if they haven't reached 65. And while it can be quite arduous to have that repeat assessment every year, or have to demonstrate you need the money every year, the positive side of that is actually you don't need to be approved straight off for the maximum level of supports you're ever going to need. So it might be that the person's needs are quite low when they first joined NDIS. They just need a little bit of support accessing the community and maybe a little bit of speech pathology or physiotherapy. But then as their care needs increase under NDIS, then that plan gets reviewed and you can put in evidence that actually the care needs are more, including group home living support. So supported independent living, I think, is what they call it.
Yeah, and honestly, supported independent living through an NDIS plan is way better than what you're going to get as a young person in residential aged care, which is often the other alternative.
And I think that's one of the primary reasons that we suggest you apply. But yeah, feel free to, I'm getting quite speedy at checking over the NDIS application forms. And I'll help you frame it exactly like Jude said, for really demonstrating the needs on your worst day, which is the most important thing. And as carers, it's really important on that to think about, when you really look across the day, how much is my person doing independently and how much am I really just there in the, am I actually doing, what would they do if I wasn't?
Yeah.
If I wasn't helping them do X, Y, and Z.
And it can be quite confronting and it can be really difficult. And it can also be very difficult to explain to people what you're doing. Because, you're a carer, but you're also a spouse or a daughter or whatever it is, whatever your other relationship is. And when does the caring come in and when does the things that you would normally otherwise do come in? And some of those things can be really blurry and really hard to explain. So, yeah, but it's really important, I think, to, if you have the opportunity to test the NDIS, I would absolutely be doing that. If I was in that circumstance, I would absolutely be doing that. There are plans for my aged care, for the aged care services to change in the future to be a little bit more like the NDIS, in that instead of there being a capped amount of money, there's the thought that there will be, I think there's, can't remember if it's 11 or 15 domains, and you will be assessed against these domains, and you might get funded for a certain amount of assistance in 5 of the 15 domains or whatever it is. So it would be similar to the NDIS in that you have like an overall budget for a particular activity, instead of the home care package where you have a big glob of money and you choose how much to use in a particular activity. It'll be a bit more targeted. But the thought is that with this reform, which is coming, but we don't exactly know when, people who currently get to that level for home care package and then have to top it up for intensive support at home will be able to access more support, more like an NDIS package. And so there are caps on the package managed for a home care package and caps on the care management for a home care package. And all of that is very explicit in the My Aged Care website. And you can go into the My Aged Care website, and every home care package provider will have their price list on the My Aged Care website. And you can compare. You can compare and contrast between however many people you want to choose from. Please don't try and do 100. You'll just drive yourself insane. You won't remember them after about 4 or 5. But yeah, it's absolutely a good idea to shop around. Be really conscious that the package management and the care management fees are not the only thing to think about. So you will have all providers will have an hourly rate for the services they're providing. If somebody's being in your home for 4 hours, they will charge you 4 times whatever their hourly rate is. They'll have a Saturday rate and a Sunday rate and a public holiday rate. All of that is charged individually, those hours, into your home care package. And that, you might think, oh, I'll go for the really cheap people because I'll save myself $10 an hour or $20 an hour for my services. But sometimes providers will put a percentage premium on a purchase. So you might have a provider who has low rates for their package management and care management, but everything you purchase through the package, they might put a fee for making that purchase. So a couple of jobs ago, I was with a company that for their home care packages decided that they would put a 10% fee on every purchase. And that was to take into account not just my time as a case manager in making the purchase, it was the people processing the invoices, it was the people doing the finance and whatever else was happening behind the scenes to make that purchase. And I argued very impassionedly in many meetings that sometimes it took me much less to order a big piece of equipment for someone, a $10,000 hoist, than it did to find a lawn mowing service, which was going to be $45 once a month. But the big hoist, which might have taken me 3 emails, 10% on $10,000, that was a lot of money for processing one invoice. Whereas the gardening service, I'll get an invoice every month, and they were getting 10% of $45 or whatever it was. I lost that argument so many times. So you have to be careful, do your shopping around. Do your shopping around. And if you find yourself with a home care package provider that you think, after a couple of months, this is really not working for me, don't be afraid to look around for somewhere else. Don't be afraid to move on. It's a business nowadays. Even if your provider is a non-for-profit, it's still a business in some way. So, yeah, don't be afraid to shop around.
I've got a question in the meantime.
Oh.
On that, in terms of shopping around, so obviously the fees and things and hidden costs are important to consider. But what about also considering, I guess, should one weigh up the different kinds of activities and stuff that the different service providers might offer? Do they differ much?
Yeah. So service providers will say they can get just about anything that they're allowed to purchase through a home care package. Any service provider, any home care package provider is going to say that. If you want to go to a social group, we'll pay for it in the package. If you want to have shopping, we can arrange that through the package. If you need equipment, we can arrange. Everyone is going to say that. I guess the things that make some people different to others. So, and this is the things that you might want to consider as what is the value proposition in this home care package. Some of the bigger providers, some of the older providers will have their own support workers who will come into your home if you're having services in your home. They will have recruited those people. Everybody who comes into your home at least has to have a police check and have an NDIS worker check or equivalent, an aged care worker check. But the bigger providers will have invested time in training their workers and making sure those workers have a minimum set of skills. And in some cases, in making sure those workers have really fantastic skills. If you're with a cheaper provider, they are most likely going to broker the services, and they will have less control over who's coming into your front door and knocking on your front door and saying, I'm here to do the service. The bigger providers will most likely have their own rostering teams and will try their best to give you some consistency. And if you have a person who is a bit confused, sometimes forming a relationship and having that consistency can be very helpful. The smaller providers who broker out a lot of services will have less control over who's coming to the door. So you might find you have an endless stream of different people coming to the door. So yeah, there's a few things to consider, but always remember, you can change. If you find something is not working, if you think you can help by working with your case manager to make it work better, as in it's a miscommunication or more guidance for the workers will just solve this problem, absolutely okay to give that feedback and to try and get your provider on board to do those things, to work with you to make this a better, and most providers will be so grateful to be able to do that, to make it a better experience. But if you think, I can't make this work with these people, you can definitely go somewhere else. Don't be afraid to do that. Diane's put a question in, can I manage my own package? At the moment, you have to have a provider to hold the money, but some providers will allow what they call self-management. Very low-cost providers will allow what they call a self-managed home care package. And what that looks like mostly for those people is that they will take the money from the government and they will skim their bit off the top, and they'll tell you around about how much money you've got to spend each week. You've got $500 left that you can spend. And then they will want you to spend that $500 yourself and send them the receipts to show that you've spent the $500 with this place in this way. And if it's a acceptable purchase of something, they will reimburse you. So you have to have that initial cash flow usually for a self-managed package, because you will be paying out of your own pocket and then being reimbursed by the provider. But so right now, at the moment, you do not get the money coming to you in the way that the NDIS allows you to manage your NDIS package. You have to have a provider for your home care package. Yes, there are star ratings and reviews for providers. Have a look on the My Aged Care website. Do you know the thing that I most like to do when I'm looking at service providers? This will just, it might not knock your socks off, but every time I do this, it knocks my socks off. I love to go in the Google reviews, because you can see the most crazy things in Google reviews. If you find a website for someone and look in the Google reviews, sometimes they're not very up to date. So, cut them some slack. Maybe this happened a while ago and they managed to fix it up. But boy, oh boy, there might be some 5 stars, but you'll also get some 1.5 stars and maybe something in between. So I always take a look in the Google reviews. I always think that's the best way to do it. and you can see some funny stories. And look, if anyone does have any questions that you think I might be able to help you with, you know how to get in touch with Penny. Penny can pass your details on to me. I'm really happy. It's always pretty simple to shoot someone an email and send you some links and help you along the way with your journey through my aged care. Always ask questions. Always, always, always ask questions. Never feel as if it's a dumb question or a, you know, why am I, they'll think I'm dumb if I ask it. Just please don't. It's a complicated system. It's such a complicated system. So always ask. And I think there was a question there that talked about how you know the value small providers and bigger providers and those kind of things. I think you'll be more likely to find providers who have your best interests at heart in a not-for-profit than a for-profit provider. So that's showing my biases because I've only ever worked in not-for-profit, but I have to say, I think you'll find people who have your best interests at heart in the non-for-profits. And there's lots of non-for-profits. Some of them are faith-based, and it's really your choice whether that makes a difference to you and who you look for. But there are plenty that aren't faith-based. Some of the big ones are, though. You know, if I say Anglicare or Wesley Mission or Catholic Care, all of those things which are all big providers. But you can find non-for-profits that are not faith-based if that's a barrier for you. And if you're involved in support groups, just ask other people what their experiences are. Ask your friends. They might have mums or dads or mothers-in-laws or fathers-in-laws who are getting help, and they might have they might either have a really fantastic experience to share with you, or they might just say, don't go to XYZ, they'll be terrible with you. Yeah. So, and look, I as an ex-home care package case manager, I had people make complaints about what I was doing. That's okay, you're allowed to complain. I still had to keep on providing the service, and that's okay too. And I had so many funny experiences where I would try and set up a service for a client, and I had, anywhere up to 70 clients at a time, and you could set up the same service provider for 2 people and ring them the next week to say, how did you go? Oh, they were terrible. How did you go? They were fantastic. So it's a very individual thing. So yeah, find the people that are right for you.
Well, thank you so much, Jude, for taking the time to, oh, well, there, Deb said it for us.
Thank you.
Deb,
That's
for those of you who can't see it, she said, Jude, thanks for a great informative session. Presentation of info was really clear and well set out, and thanks for answering my questions. Terrific. Loved it.
You're welcome.
Yeah. And just to echo what Jude has said, feel free to drop me an email and I'll forward it on to Jude. And me an email if there's questions about NDIS too that I can help or direct you to someone else. Thank you for joining us all. For joining us both this evening.
Thank you so much.
It's been fun.